Hello everyone, I am Dr. Swati Gogineni. I am a consultant obstetrician and gynecologist and infertility specialist at Apollo Cradle Jubilee Hills and Apollo Clinic Manikonda. So I am here to talk about PCOS management. So what is PCOS? So PCOS stands for Polycystic Ovarian Syndrome. Normal cycle length in a woman is 22 to 35 days. Any cycle less than 22 days or more than 35 days is considered to be abnormal. It can affect women of all ages, right from the time of adolescence till menopause. So what exactly is it? So as the name suggests, there are multiple small follicles. They are not big cysts actually in the ovaries as the name suggests. They are nothing but tiny follicles. So multiple, and they are all immature follicles. So they are all small to intermediate sized follicles. And there are too many of these in the ovaries, which makes the ovaries bulky. And there is a lot of hormonal imbalance due to this, lot of insulin resistance that builds up, lot of tissue resistance that builds up, and usually high androgen levels are also associated. So all these puts the woman at risk of many symptoms. And it affects women of all age groups. Previously, it was only women of in their 20s and 30s and mainly affecting fertility. But now if you see, it is right from the adolescence, and even women who haven't had any of these symptoms suddenly come in their 40s with the symptoms. It has become a very common condition nowadays. So what are the ways in which it can present? So there are some gynecological symptoms and there are also non-gynecological symptoms in PCOS. Coming to the gynecological symptoms, the most common is irregular periods. So as we know, a normal menstrual cycle is between 22 to 35 days. So anything less than 22 or more than 35 days is called irregular. So the common symptom of PCOS is irregular cycles. In addition to this, there can be an irregular flow pattern, like very less flow, or sometimes there can be prolonged bleeding, or sometimes there can be irregular bleeding, that is, there is no relationship with the period at all. There can be intermenstrual spotting, bleeding, where the lining does not shed properly. Or in addition, menstrual symptoms are not the only symptoms. There can be other symptoms like excessive hair growth on the body, like excessive facial hair or hair on the chest, or there can be thinning of scalp hair. That is mainly because of the high androgen levels. They can present with acne, they can present with oily skin, or sometimes fertility issues. Now, why do they have fertility issues? It's again because of the hormonal imbalance. They don't get their periods normally. So there can be issues with the egg growth. Okay, there can be issues with egg maturity, and the follicle might not rupture, ovulation might not happen, or their egg quality might be bad. And there are also issues with the endometrial lining, that is the receptivity. So all these makes them a little bit more difficult to conceive. So again, not all women with PCOD have problem conceiving, but yes, we do come across a good number of people. And what are the main reasons for PCOD? It is multifactorial. Okay, it is not one reason where we can pinpoint to. So unfortunately, it is multifactorial. So there is a genetic component, unhealthy lifestyle, and a sudden gain in weight. But nowadays we see both extremes. We see lean patients, we see obese patients also with PCOD, but it is mainly the unhealthy lifestyle, that is indulging in a lot of junk food, lack of exercise. So all that builds up a lot of tissue resistance. Of course, in addition to this, stress and strain and environmental pollution, pesticides, and the ingestion of too many hormones, all these are also considered to be risk factors. And certain other things like, a family history and obesity, and they are also known to be additive factors. So once a woman is diagnosed with PCOD, so coming to the workup, of course, a detailed history and a family history, and certain blood investigations like, their complete blood picture, sugars, because sugars tend to be higher in these women, and their thyroid profile, prolactin levels, their androgen levels also need to be checked, and ultrasound follow-up is also needed. And how do we manage PCOS? So PCOS, as I told you, is multifactorial. Okay, it is not just one etiology where we can aim at the etiology and create a medicine. Unfortunately, there is no tablet that can actually cure PCOD. So once a woman is diagnosed with PCOD, it is there with her lifelong. But the moment there is a diagnosis of PCOD on scan, she need not worry. The main aim of our treatment is actually to control or minimize her symptoms. So even our treatment must actually follow a multidisciplinary approach. And first and foremost in the management is a healthy lifestyle. She's supposed to take a low carbohydrate and low fat diet. The diet, of course, should be good in proteins, and adequate hydration is very important. And exercise is also very important. So exercise for about an hour every day. Walking is the best form. Of course, they can indulge in other exercises also, like yoga, meditation, or certain other physical exercises. But exercise every day, and a reduction of at least 2 to 3 kgs will do good in regularizing her periods. So first and foremost step in the management is a healthy lifestyle, that is lifestyle modification. In addition to this, hormones depending on the symptoms. Of course, they do have to visit a gynecologist for menstrual irregularities. Necessary hormones would be given. Similarly, if there are any issues conceiving, they'll have to meet a gynecologist or a fertility specialist and take appropriate treatment, and that might include ovulation induction to IUI to IVF depending on the situation. But losing weight is the most important thing. And in addition to this, as I told you, it is not just gynec symptoms. Sometimes it might be hair related issues, it might be acne, oily skin. So it's again a multidisciplinary approach with endocrinologist and with a dermatologist, where they can go for some local treatments like electrolysis or laser, or sometimes even systemic medications as advised by them. And unfortunately, PCOS doesn't just end only with menstrual symptoms or fertility. It puts them at a risk of other systemic diseases like hypertension, diabetes, and abnormal lipid profile, sometimes even thyroid disorders. So again, we have to work as a team with the endocrinologist and the physician, evaluate even for those conditions, because sometimes the symptoms might be totally unrelated to gynec, but only to those things. So we have to work as a team with the physician and endocrinologist and do the needful for the patient. So ultimately, it's a multidisciplinary approach. Thank you.